There's no cure for chronic kidney disease, CKD, but treatment can help relieve the symptoms and stop it getting worse. The treatment will depend on the stage of the chronic kidney disease. The main treatments are 1. Lifestyle changes to help you stay as healthy as possible. 2. Medicine to control associated problems, such as high blood pressure and high cholesterol. 3. Dialysis, treatment to replicate some of the kidney's functions, which may be necessary in advanced stage 5 chronic kidney disease. 4. Kidney transplant, this may also be necessary in advanced stage 5 CKD. This video focuses on the medications used for chronic kidney disease. There's no medicine specifically for curing CKD as a disease, but medicine can help control many of the problems that cause the condition and the complications that can happen as a result of chronic kidney disease. You may need to take medicine to treat or prevent the different problems caused by CKD. If you have high blood pressure, your doctor will like to control it. Good control of blood pressure is vital to protect the kidneys. People with kidney disease should usually aim to get their blood pressure down to below 140/90, but you should aim to get it down to below 130/80 if you also have diabetes. There are many types of blood pressure medicines, but medicines called angiotensin-converting enzyme inhibitors are often used. Examples include ramipril, enalapril, and lisinopril. If the side effects of angiotensin-converting enzyme inhibitors, ACE inhibitors, are particularly troublesome, you can be given a medicine called an angiotensin II receptor blocker, ARB, instead. Another common problem associated with chronic kidney disease is diabetes and high albumin to creatinine ratio, ACR. If you also have type 2 diabetes or a high albumin to creatinine ratio, ACR, you may be offered a medicine called dapagliflozin, as well as medicines for high blood pressure. Dapagliflozin helps to lower your blood sugar and can reduce damage to your kidneys. High cholesterol is also commonly associated problems seen with people with chronic kidney disease. This puts people with CKD at higher risk of cardiovascular disease, including heart attack and stroke. This is because some of the causes of kidney disease are the same as those for cardiovascular disease, including high blood pressure and high cholesterol. You may be prescribed medicines called statins to reduce your risk of developing cardiovascular disease. Examples include atorvastatin and simvastatin. You can subscribe to our channel to find out more about how to lower your cholesterol level. The next thing your doctor will want to control is your potassium levels. People with CKD can develop high potassium levels in their blood, called hyperkalemia, because their kidneys do not work properly. Hyperkalemia can cause muscle weakness, stiffness, and tiredness. If it becomes severe, it can cause an irregular heartbeat. We also call that arrhythmia, which can lead to a heart attack. If you have CKD, it's important to avoid taking potassium supplements and some medicines used to treat high blood pressure and heart failure because they can make your potassium levels too high. Talk to a general practitioner about the medicines you take if you're worried. A medicine called sodium zirconium cyclosilicate can be used to treat hyperkalemia in adults in emergency care for acute life-threatening hyperkalemia alongside standard care. Note that there are a lot of cautions that need to be taken before using this drug. The fifth problem in patients with chronic kidney disease is water retention. You may get swelling in your ankles, feet, and hands if you have kidney disease. This is because your kidneys are not as effective at removing fluid from your blood, causing it to build up in body tissues. We call this edema. You may be advised to reduce your daily salt and fluid intake, including fluids in foods such as soups and yogurts, to help reduce the swelling. In some cases, you may also be given diuretics tablets to help you pee more, such as furosemide. Another problem commonly seen in people with chronic kidney disease is anemia, which is a lack of red blood cells. In simple terms, we can say low blood. If you have anemia, you may be given injections of a medicine called erythropoietin. This is a hormone that helps your body produce more red blood cells. If you have an iron deficiency as well, iron supplements may also be recommended. You can subscribe to our channel to find out more about how iron deficiency anemia is treated. If you have anemia but do not have iron deficiency, you may be given a medicine called roxadustat. This medicine helps your body to produce more red blood cells and comes as tablets. Number 7. Bone problems. If your kidneys are severely damaged, you can get a buildup of phosphate in your body because your kidneys cannot get rid of it. Along with calcium, phosphate is important for maintaining healthy bones. But if your phosphate level rises too much, it can upset the balance of calcium in your body and lead to thinning of the bones. You may be advised to limit the amount of food you eat which are high in phosphate, such as red meat, dairy products, eggs, and fish. If this does not lower your phosphate level enough, you may be given medicines called phosphate binders. Commonly used medicines include calcium acetate and calcium carbonate. Some people with CKD also have low levels of the active form of vitamin D, which is necessary for healthy bones. If you're low in active vitamin D, you may be given a supplement called cholecalcitriol to boost your active vitamin D level. The next problem in chronic kidney disease that require treatment is what we call glomerulonephritis, which means inflammation of the filters inside the kidneys. In some cases, this happens as a result of the immune system mistakenly attacking the kidneys. If a kidney biopsy finds this is the cause of your kidney problems, you may be prescribed medicine to reduce the activity of your immune system, such as a steroid or a medicine called cyclophosphamide. Please subscribe to our channel so that you can be notified when we release the next video. Note that knowledge is advancing by the day, and we will like to always post an update on new advances on how to stay healthy. You can contact us via the link in the description below for any medical inquiry. You are watching Zoom Hospital channel and listening to work of Dr. Kayode.